Welcome, everyone. Thank you for joining today's webinar focused on research and evaluation needs to support sustainable health programs. My name is Sally Zweimüller, Senior Advisor for Communication and Dissemination at D4I, and I am introducing today's webinar. Data for Impact, or D4I, is funded by USAID. D4I is a consortium led by the University of North Carolina at Chapel Hill in partnership with Palladium, ICF, JSI, and Tulane University. D4I strengthens local capacity to generate and use high-quality health data for strategic decisions on health policy and programming at national, subnational, and community levels. D4I investigates program effectiveness, integrates gender into all activities, supports adaptive management, and learns from evidence. D4I draws on the technical expertise that exists in our partner organizations, and we have an extensive network of local partners in USAID's priority countries. Today's webinar focuses on an activity completed under D4I. Today, the presenters will speak in English. We are providing live French interpretation as well. So we'd like everyone to click on the interpretation icon at the bottom of your Zoom screen. Select off if you'd like to hear the original English. Select French if you'd like to hear it in French. For those using French interpretation, you can also select to mute the original audio so you don't hear in the background. You may also select to turn captions on to read the spoken audio during the session. To turn the closed captioning on, click on the icon with the two C's at the bottom of the Zoom screen. If you wish to hide the captions later, please select the same icon again and select Hide Subtitle from the menu that appears. These captions are generated using an automatic feature in Zoom. Therefore, they might not be 100% accurate, especially in languages other than English. Lastly, we are recording this webinar and we'll be sharing this in an email following the webinar. Today, our presenters are, we will start with Lwendo Moonzwe Davis, MPH, PhD. She's an activity lead with D4I. She has training in sociology, public health, and women's studies, and has extensive experience conducting global health research and evaluations. Sara Hachemian is a research assistant with D4I. She has expertise in global health, public health research methods, and recently completed a master's in public health. Lauria is a senior researcher with D4I. She has expertise in program implementation and implementation research, and is currently a doctoral student in health systems and policy research. And then we also have Oluwayemisi Ishola, a senior researcher with D4I. She has expertise in program implementation and public health research, and is pursuing a doctoral degree in health promotion. I will now hand over the webinar to Lwendo to introduce today's topic.
Thank you, Sally, for that introduction, and thank you all for joining us for today's webinar. We will begin with a presentation of the activity that informs today's content, as well as the webinar objectives. Next, we will introduce Jamboard and describe how it's going to be used in today's webinar. We will briefly describe this activity's methods and analytical process and provide an overview of the findings that guided the resulting recommendations. The bulk of this webinar will be spent presenting the initial recommendations and gathering your feedback using Jamboard. Lastly, we will finish with some concluding remarks and share next steps. Next slide. The activity that informs today's webinar focuses on conducting research to identify best global practices and existing gaps in strengthening research and evaluation capacity for sustainable health programming, and to develop recommendations that can be used to inform future efforts in this area. There is growing interest in this topic as evidenced by USAID's local capacity strengthening policy and localization guidance. Yet, recent initiatives to promote sustainability have often focused on programmatic concerns, leaving out research and evaluation considerations. Further insights are necessary to understand the research and evaluation needs for strong health programs. For today's webinar, we will present the activities approach to gathering information and the preliminary recommendations that have emerged. We will then ask you to provide some feedback on these recommendations using Jamboard. This will help us to finalize the recommendations for USAID. The intent is to hear from a diverse audience with particular interest in hearing voices from and perspectives from low and income country settings, and to incorporate this feedback into our final recommendations. Next slide. So Jamboard is an online digital whiteboard for remote collaboration. This is the platform we'll be using to gather feedback. We will keep the link open for the next 24 hours to allow the opportunity to provide further input after the webinar. So during the presentation, we will pause at 2 different times to allow the audience to reflect and provide input on the recommendations that were just previously presented. You'll see the Jamboard link in the chat. We encourage you to click on it to become oriented with the platform, but we will also do a demonstration when we get to the first pause in the webinar. Next slide. I will now turn it to my colleague, Sara, who will present the activities, methods, and analytical process.
Thanks, Lwendo. So we started to gather information on best practices and gaps. We conducted a literature review to see the existing evidence. We used keywords based on the activity objectives and initially limited the search to gray literature and peer-reviewed articles published after 2010. Based on the initial findings, we identified and included additional sources. For the gray literature, we used 3 USAID platforms: the Development Experience Clearinghouse, or DEC, the Learning Lab, and the USAID website, as well as internet searches. The platforms for the peer-reviewed literature search included Google Scholar and PubMed. The stakeholder consultations, which I'll discuss in the next few slides, also provided resources which we included in our review. The review resulted in 89 total documents. Of these, 54 were from the gray literature and 35 were from the peer-reviewed literature. The gray literature included 32 USAID project reports, 9 external USAID reports, and 13 commentary documents about USAID's approach on the subject. Next slide. We conducted stakeholder consultations and interviews to learn more about research and evaluation efforts and needs through 10 semi-structured interviews with USAID staff. These USAID staff individuals were selected based off of their knowledge and work on the topic, who in turn recommended knowledgeable colleagues. Those are reflected in the table you can see on the left. We also conducted interviews with 13 individuals from 6 research and evaluation organizations based in low and middle income country settings. We spoke with organizations that had collaborated with D4I and our respective institutions. These are detailed in the table on the right. During these interviews, the participants identified additional resources for the literature review. We took notes from each discussion to code and include in our final analysis. Next slide, please. The analytical process for this data entailed conducting thematic analysis by reviewing coded excerpts from the literature and interviews. We conducted exploratory analysis using software analytical tools, including reviewing code co-occurrence to explore areas of thematic overlap. Generally, the themes were consistent across data sources, but there were slightly different topics emphasized based on the document type or type of interview. Next slide, please. I will now hand it over to my colleague Molly to discuss the findings and first part of the recommendations.
Thank you, Sarah. So across the literature, there were 6 themes that emerged, and these themes were further corroborated and expounded upon through our interviews. Next slide. The thematic areas that emerged from our analysis included the following. First, it is important to shift to a systems approach to build and maintain research and evaluation capacity. Second, strong governance structures and a supportive environment are prerequisites for sustainable efforts. Third, locally led development was a key element, while the topic of localization was prominent within the USAID focused literature. Fourth, there is limited funding from and for the local level that targets evaluation and research capacity and is considered sustainable. Fifth, efforts need to focus on supporting career development, particularly during the early and mid-career stages. And lastly, as a field, we need to better develop and apply metrics and frameworks to assess these evaluation and research capacity strengthening efforts. So based on these 6 themes, we developed specific recommendations tied to each. Next slide. So now we will present the preliminary recommendations for each of these themes in 2 parts. After presenting the first 3 themes, I will pause the presentation and shift to Jamboard so that you can share your reflections and suggestions. Next slide. So the first recommendation concerns the importance of applying a systems approach to build and maintain capacity for research and evaluation. Taking a systems approach recognizes that capacity strengthening needs to engage with multiple levels, from the macro, institutional, to the individual level, and should include actors across social levels within the system. Efforts should then prioritize implementation research. This will provide the global community with an understanding of how a systems approach was used and the resulting capacity strengthening outcomes. Our third recommendation for this theme is to invest in and to promote long-term programs that use a systems approach to strengthen local research capacity, specifically to ensure that there is a strategy in place at the mission level for implementing local solutions informed by local priorities and existing programs or institutions. The graphic on the right is adapted from an article that we found in the literature review. It illustrates the various levels of capacity strengthening using a systems level approach. The article emphasized that complementary approaches to human resource development work best in the context of a systems and a long-term perspective, where efforts build upon each other across the levels shown in the graphic. Next slide. Continuing our recommendations on this first theme, we also recommend for efforts to establish and maintain a culture that is supportive of the research and evaluation workforce. It is important that there is a shared responsibility to support this workforce across all levels of the health system and associated partners. We also recommend to incorporate training and capacity strengthening efforts into existing pre-service and in-service training programs. Linkages to higher education are needed for long-term sustainability through initial training and continued educational opportunities. We also recommend strengthening networking for better collaboration. Networks can build the intellectual and social capital for research. Strategies for developing networks include using national researcher registries, including with online access, networking events, increased accessibility to scientific conferences, seminars, workshops, and public forums. And lastly, we emphasize the importance of having a culture of data use and learning within the health system by using routine data. This data is too often used solely for monthly reporting purposes. Promoting and supporting the proactive use of this routine data can improve data quality and programming efforts, as well as contribute to a supportive environment for research and evaluation across various levels of the health system. Next slide. Now let's shift to the second theme, which states that strong governance structures and a supportive environment are prerequisites for sustainable efforts. The recommendations around this theme include to form and engage with technical working groups of country-level stakeholders. These can help mitigate communication challenges and promote needed multi-sectoral collaboration. Consider governance and management aspects in programming and study design. Focus on how efforts can strengthen local capacity and also be sustainable. Support partnerships and collaborations between health programs and local universities. This could ensure that the health research agenda addresses national priorities. Advocate for increased domestic and external resources for health research. Countries committing to enhancing their research systems must also make sufficient investments to strengthen their research environment. Establish a long-term partnership and growth mentality. The research showed that successful partnerships and collaborations had clear communication, respect for cultural differences, clearly defined roles and responsibilities, as well as equitable distribution of leadership. And lastly, strengthen the public sector's research skills and capacity to use findings towards improvements. So although public sector M&E structures do exist, they are often not being used adequately to inform programming using data. Next slide. The third and last theme that I will present concerns the importance of supporting locally led development. The recommendations include to ensure that funding opportunities for research and evaluation are shared with local research partners so that they are informed of opportunities when they become available to the public and not just when partners in high-income countries are looking for local partners. We also recommend to ensure that there is an equitable distribution of labor and that partnerships are country-led so that local partners are not just responsible for data collection, but rather are engaged and lead each component of the research cycle with targeted capacity strengthening efforts integrated as needed. And lastly, to invest in increasing opportunities for collaboration and cross-learning within research and evaluation partnerships. Next slide, please. And additional recommendations to support locally led development include to invest in training and supporting local organizations on the compliance and management aspects for USAID. These can be a major impediment, and therefore targeted approaches are needed to better support local partners. To embed capacity strengthening into research studies. There are many opportunities within the research cycle for integrated mentorship and learning. Engage in extensive conversations with potential partners prior to agreeing to the partnership or signing an MOU. Again, this is intended to ensure that local partners are engaged in an equitable manner from the onset. And our last recommendation for this theme is to dedicate the necessary time to develop a mutual understanding of roles and contributions. This will allow the partnership to embed capacity strengthening and to establish a more equitable partnership. And now I'll pass it off to Lwendo so that we can hear your feedback on these recommendations. Next slide.
Thank you, Molly. We will now turn over to Jamboard to get your feedback on the recommendations that we've presented thus far. So the three themes of systems lens, governance and accountability, and locally led development. You should find the Jamboard link in the chat. So please click on the link and open the link in a new web browser window. And we are now projecting the Jamboard link. You'll see the first slide presents the 6 themes, and we'll move to subsequent slides to add sticky notes with feedback on each of the respective themes. So Sally's demonstrating how to add a sticky note. You could see it on your panel to the left, about the third button down. Click on the sticky note. You could be able to type in your response and save the response, which will then enable you to place a sticky note. We'll be monitoring also the chat to include any recommendations And please feel free to type in your additional recommendations, thoughts, perspectives, or insights in either English or French. I will pause here for a few minutes to give the audience time to start to provide any additional insights. If you do have any questions, please feel free to raise your hand, or if you prefer to share your responses audibly, also please feel free to raise your hand. Yes, you could start on the third slide, which is about a shifting to a systems approach. However, if you have recommendations or insights on any of the additional themes, you could scroll over and add your insights on governance or on localization. And just to let you know, all your responses here are anonymous. Thank you for the insights coming in so far. As mentioned also, please feel free if you have insights on some of the other recommendations that were shared, you could go panel over for the different ones. I see some additions on localization. And for those of you that are just joining us, we have put a link in the chat to the Jamboard, and we are asking for additional insights, thoughts, additional recommendations, areas that we should focus on for the various, the first three themes that were presented. See a lot of themes coming and additions coming in for the shifting to a systems approach. But just a reminder, if on the top you scroll over, there are subsequent slides where you could add your recommendations along around governance and a supportive environment, and also around localization and locally led development. Thank you. We're just demonstrating again how to use the sticky notes. If you go to the panel on your left, about the fourth button down, the sticky note button, and you could type in your response. So as people are still typing in responses, if there's anyone that would like to share or speak up, please just raise your hand and the host will unmute you. We'll take a few more minutes here before we go to the next set of recommendations. Thank you all for your insights. As I mentioned, that Jamboard link will remain open, so please feel free to continue to add any suggestions. For now, we will move on to the second set of recommendations, and I will turn it over to my colleague, Yemisi, to present on these topics.
Thanks, Lwendo. I'll be presenting the last three themes. The fourth theme focuses on the limitation of funding from and for the local level targeted for research and evaluation capacity. We found that specific funding dedicated towards research and capacity strengthening is often limited, and this poses challenges for local organizations and individuals seeking to strengthen their research and evaluation skills. Some of the recommendations for funding include establishing reliable and sustainable funding sources. These tend to include money from the central government's training budgets, income from cost of courses, consultancy services, and research grants. Changing how international funds are distributed to low and middle income countries by mandating a portion of these funds to local research teams as core funding may increase the demand for and funding of research at the national level. Another recommendation is the need to strengthen national researchers' capacity and sensitize decision makers to the potential of health and policy systems research. Building a skilled and competent workforce of researchers within their own countries can reduce reliance on external experts and better address the specific gaps and policy needs of their countries. The text box on the right shows some funding excerpts from the interviews where researchers reported that funding was largely via partnerships with prime organizations, and funders most often advise them to partner with the prime organizations as sub-recipients, majorly because those organizations are presumed to be bigger and have more capacity. Next slide. Additional recommendations to support funding include the importance of developing skills relating to financial plans development and establishment of fundraising strategies. These skill sets are critical for identifying and avoiding multiple low-value short-term contracts that have high administrative costs. Another recommendation is to advocate for increasing local investment in research and evaluation to enable self-sufficient research activities, while ensuring that external investment in research capacity strengthening align with national priorities. It is also important to examine and document successful transitions from relying on external funding to increasing in-country funding. Documenting these experiences of geographies that have effectively achieved this transition is crucial for building a sustainable research ecosystem. Next slide. So theme number 5 emphasizes the importance of career development for the evaluation and research workforce, especially during early to mid-career. Research scientists from low and middle income countries have had access to academic and professional training and fellowship programs to enable them to expand their competencies. A good example is where one of our key informants mentioned the organization's support in advancing academic degrees up to doctoral level. And some key recommendations for fostering career advancement includes increasing qualified mentors and facilitators to support capacity strengthening. This can be achieved in different ways, including providing strong mentorship and supervision support, mostly by experienced research managers. Another key recommendation is the provision of short course training for staff with a focus on junior staff where funding is limited. In this regard, team learning should be encouraged over individual learning. And to make the most of the existing capacity, organizations can adopt the approach of involving those who have gained skills in previous research capacity building initiatives and allowing them to mentor and support early to mid-level researchers as they become experts. Next slide. Still on career development recommendations, for clinical professionals, strategically integrating research-related training and mentorship programs into existing pre-service and in-service training will stimulate research interests, thereby fostering a culture of research within the healthcare system. Also, following the reported limited competency to process and analyze big data in some contexts, there is a need to intentionally invest in building expertise around specific areas where there are obvious gaps. And also, academic training programs should see the importance of designing educational programs that prioritize hands-on practical skills development in research. Students should actively be involved in research projects during the academic training, and this will allow them to apply the theoretical knowledge they acquire in the classroom to actual research activities. Another recommendation is to identify opportunities for cross-learning and knowledge transfer activities in country. For example, academic institutions can benefit from the field experience in the health sector, while the health sector also benefits from research analytical competencies that are available in the academic institutions. The right side of the slide shows examples of organizations offering research capacity strengthening programs. The Fogarty International Center's research training offers numerous career development programs for individuals in low and middle income countries. And worthy of note is the renowned Global Health Program for fellows and scholars. And also the Center for Social Research in Malawi focuses on offering short course training to junior staff on different research and evaluation topics. Next slide. The last theme I'll be presenting is the need to develop and apply metrics and frameworks to assess evaluation and research capacity efforts. Evidence suggests that there are various tools available for evaluating research capacity strengthening across the different domains. However, little information exists on measuring how research capacity development efforts have contributed to better performance over time among organizations that have received such capacity development support. Some recommendations under the matrix and frameworks theme include the need to define indicators in ways that captures the perspective and experiences of those receiving capacity strengthening support, as this will help ensure that research capacity measurement is more relevant and responsive. Also, to effectively measure research capacity improvement progress, it is essential to prioritize capacity evaluation design and systematically link indicators in line with theories of change. Since interventions have the potential to become more robust, especially when priorities change mid-implementation, it is important to prospectively project how capacity strengthening and improvement indicators will be measured when such shifts happen. Another recommendation is incorporating specific indicators and measurements related to research capacity and performance into the overall monitoring systems of health programs. Next slide. Other recommendations on metrics and framework include avoiding attributing results directly to individual programs. And it may be useful to use complementary indicators to measure capacity strengthening outcomes, especially in contexts where multiple projects are implemented. In cases where attribution is inevitable, it is important to note or acknowledge the contributions of other programs that are directly implementing similar interventions. It is essential to strike a balance between easily measurable indicators and a more comprehensive evaluation of impact to ensure accountability. This can be achieved by making a clear distinction of early stage indicators that measure output level results and other indicators that measure long-term outcomes. I will now hand over to Lwendo to walk us through gender and equity considerations and talk about next steps. Over to you, Lwendo.
Thank you, Yemisi. So from the literature review, we also explored the themes of gender and equity. We wanted to take a targeted search to see how the literature addresses this topic or these topics. Although discussions were limited, there were some key recommendations that emerged. These include having an awareness of the culturally dependent expectations in relation to training and mentorship styles, and being mindful of language and culturally variable communication styles. Next, making an intentional effort to address gender imbalances, and this can include having incentives to help mitigate them. Applying a gender and social inclusion lens to all capacity strengthening activities is also critical. Although system strengthening is vital, without a gender and social inclusion lens, it risks anchoring organizations in a system benefiting those within inherent power structures. We also recommend promoting and facilitating the systematic use of data to achieve greater gender equity. And lastly, capacity strengthening efforts should also be guided by principles of gender equity and the protection of the most vulnerable. Next slide. So we will now turn back over to Jamboard to allow you to provide some insights and thoughts on the next 3 sets of recommendations and also the gender inclusion. We could put the link in the chat again. And just to remind participants, if you are on the top, click on the top right as Sally's demonstrating. You could scroll through to the different pages to put your recommendations on the respective pages. We saw a few people putting some recommendations on the first slide. So that's an option available to you for gender and equity considerations. We have some sticky notes there already. You could just click on them and type in, or also click on an additional sticky note. We will go over next steps and how this information will be disseminated. I see that's one of the questions. And also now we will open it up if you have any comments or would like to speak to share some thoughts or insights. I know Winnie had her hand up earlier. If you could raise your hand again, and the host will unmute you to be able to speak. David, are we able to unmute Winnie?
Yes, I have asked her to unmute. So at this point, it's up to her if she would like to speak.
Okay, thank you.
We do also have a question in the Q&A that says, are there any research groups that can be recommended to us? From Valessa Johnson.
Engaged with, as well as those that we identified in the literature. So that will be something that will be provided in our recommendations. Just want to again thank you all for your input. I see some additions here on career development, including scientific communication and technical writing. Definitely, I see some mentions of specific groups that could be included. And we will take note, definitely review all of these and incorporate them into our recommendations. Also, if there are any thoughts specifically on applying metrics and frameworks, this was a topic that we were newly exploring and had some initial insight and recommendations that were presented, but any thoughts or examples of metrics that your respective organizations or you as individuals have been using, or any metrics that you think would be useful on this topic that are not available, that would also be important for us to get some insights on. And once again, we do have a few more minutes, so if anyone would like to speak, share any thoughts, please feel free to raise your hand and we will be able to unmute you. Additionally, ideas of examples around these themes of things that have worked well for you or things that have not worked well, that would also be important for us. And the first two slides on the slide deck provide a recap of the 6 thematic areas that we presented on. And as Sally is panning over to that, those first summary slides there. So please provide your insights on the subsequent slides. But if you need a refresher, I know the first topics we discussed were about shifting to a systems approach, have governance and supportive environment, and localization and locally led development. We then spent the second half of our webinar talking about finance, metrics, and career development. The last few slides on here provide some space to provide any additional thoughts or inputs on equity and gender considerations. And once again, if you would like to speak up, please feel free to raise your hand.
A question in the Q&A from Nana Hanson Hall. It says, health is often at the forefront on the metrics for system strengthening. I would be interested in knowing if/how you have engaged with non-health sector actors, such as those in the justice system, law enforcement, judiciary, parasocial workers, etc., and any recommendations you have based on those experiences.
For this specific assignment, no, we did limit our engagement to the health sector. Although your point there is very well noted, specifically in terms of the justice system and how that intersects with the health sector. However, though, when we were discussing the systems approach, there is where we did look at the intersection of other actors, specifically out of the health sector, but not in relation to metrics. I don't know if any of my other colleagues, Molly, would like to add anything on that?
Sure. I'd just like to note that we did talk to some people at USAID that focus on education, and we talked about with them how they've been working with higher education institutions, so universities, and talking about efforts in which they were working with them directly and also working to support capacity strengthening. So there are some lessons learned outside of the health sector, specifically at USAID, of approaches to support strengthening at a more of a systems level, with that one example.
And thank you for the question, Nana. We will give it just a minute or so for any additional insights. Just again, reminding that if you scroll through, there are several slides where you could provide this information to. We will be reviewing all of these recommendations and incorporating this into the guidance that we are developing. You could also, if you're more comfortable using the Zoom chat features, please feel free to type in any questions there, and we'll make sure to incorporate them into the Jamboard for those that cannot access Jamboard. Okay, so Sally, perhaps we could go back to the slides. We could go to our slide on next steps. Thank you, Patrick, for your research groups in Kenya. If there are specific names, please feel free to share either in the chat on the Jamboard, or you could also email us directly. So thank you all for your participation. I see a lot of great additions and recommendations in the Jamboard. I really appreciate everyone taking the time to engage and provide those insights. In terms of some immediate next steps, this recording will be shared to everyone that's registered. You could continue to provide feedback via Jamboard until tomorrow. But of course, we're always open for you to email us at any time with questions and comments. We are working on finalizing a guidance document. So these inputs will be used to help finalize our guidance document, which will be published at the end of 2023. You will see this on the D4I website, and we'll make sure to do our best to share with all the people that registered for this webinar when that guidance document is published. Yes, thanks, Amani, on your comment here in terms of factor of time that needs to be included. And I'm just making sure, is there anything else in the Q&A?
Yes, we do have a Q&A comment from Victor. And it says, it would be useful to create a hub online where teams can share best practices in a more structured manner and targeted outcomes. There are many innovations happening that are not documented that can be used to improve capacity of others.
Definitely. Thank you so much, Victor. We will include that recommendation. Yes, we'll do our best to alert everyone when the guidance document is published. We're targeting later this year. And noted Amani, time plus continuity as a factor. We did have a lot of recommendations around that, just making sure, taking a long-term view and approach. And we could go to the next slide. So we want to thank everyone again for your time and participation in this webinar. Once again, please feel free to continue to share your insights via Jamboard. We just have a couple minutes left. Just making sure there's no hands or outstanding comments in the Q&A. If not, we will be closing out in a few more minutes. Thank you so much again for your participation today.